First of all, thank you all for joining us. We really appreciate you taking the time. We hope this is a really valuable resource to you, and we're really excited for this webinar. This is going to be the first of many. We do hope to have monthly webinars moving forward. So, and we'll talk more about that, about our plan for other topics for our webinars later. But this is the first one, which is about credentialing. So first, I will introduce myself. I'm Alex Gonzalez. I am a nurse practitioner, and I'm the Director of Client Success here with Collaborating Docs. I'll let Jasmine, my counterpart, introduce herself as well.
Hello, everyone. My name is Jasmine Jackson. So I'm also a nurse practitioner and the Senior Client Success Rep with Collaborating Docs.
Thanks, Jasmine. So welcome, everyone. So we're really excited to learn more about credentialing from one of our experts. I believe I see Tiana popped in. Hi, Tiana. Thank you for joining us.
Thank you. Thank you so much.
Wonderful. So we'll let Tiana introduce herself in a minute, but first I just wanted to go over a little rundown of the webinar today. So first, feel free to have your camera on if you're comfortable with that. We'd love to see you. You're also welcome to leave it off if you prefer that, whatever is your preference. We are going to ask everyone to stay muted unless you're asking a question. So just keep an eye on that mute button throughout. And then we are going to have a question and answer segment at the end of the webinar. So if you have any questions throughout, we'll give you a chance to ask questions, even if they're questions about your own credentialing process or credentialing advice that you need specific to your state or to your scope of practice or anything like that. You are welcome to ask those at the end. But if you have any questions throughout the presentation, please feel free to put it in the chat. If you don't want to ask the question yourself, I can ask it, Jasmine can ask it. So feel free to put it in the chat throughout the presentation, and then we will ask everything at the end. So that way you get all of your questions answered. And then one small blurb. So if you are not a current client and you are potentially opening up your own practice or in need of a collaborating physician, please go ahead and stay on until the end of the presentation. At the end, we'll go over some information about that related to collaborating docs. So you can stay until the end for that. And that's all. So thank you so much on behalf of Collaborating Docs and Medy Solutions Management for joining. So I will let Tiana introduce herself. We are so thankful for Tiana joining us and bringing her wealth of knowledge and expertise in credentialing today. So really excited to learn a lot more about that and share that with you all. So Tiana, if you don't mind introducing yourself, and then Jasmine's going to go ahead and pull up the presentation and we'll get started. Thank you, everybody.
Thank you. Thank you so much for that introduction. So my name is Tiana Crane, and I have been in the healthcare industry for about 24 years. I have worked in different departments as far as with the healthcare. I worked as an auditor for Blue Cross Blue Shield of Texas, United Healthcare, and for Kaiser. I was a high dollar claims auditor, so I had a higher level skill set regarding claims compliance and auditing. I have also worked in the practices. So I worked in different clinical settings as a billing manager, as a consultant, and then I actually started the company for Medy Solutions about 6 years ago, just so I can be in a position to share my knowledge with multiple practices at one time. So that's just a little bit about me.
Wonderful, wonderful, awesome. Well, we can't wait to learn more. So Jasmine has the presentation pulled up, so we'll click through that for you, and we'll let you dive on in.
Okay, awesome. Thank you so much. Okay, so we're going to start out with basically understanding what credentialing is. So whenever you are actually getting started with starting a new company or even starting your own company, you have to go through a credentialing process. So basically, credentialing is the process of establishing the qualifications of licensed medical professionals and assessing their background and legitimacy. Payers verify all the educational documents, certification, work history, expertise, and specialties before contracting with healthcare providers. And so this is what credentialing is. You can go to the next slide. So a lot of times with providers, there is a I guess I don't want to say misunderstanding, but a lot of providers think that once you get credentialed that you're already contracted. But there's the credentialing process is basically doing a screening, as if you were doing a job interview. And then contracting is when you actually get the job offer. So that's the best way that I can explain it, that, you know, it's in real life terms. So contracting is a separate process, and once the payer completes the credentialing process, so once they are done with your overview and your screening, then they move over to contracting. And so with the contract, what they'll do is they'll offer you payer rates. And a lot of times whenever you receive a contract, I've seen in multiple groups where people have asked, do you mind sharing me your contracted rates with Blue Cross, or do you mind sharing your contracted rates with United Healthcare? The contracted rates are different. So the way that they determine what your contracted rates are is basically they take the demographics. So basically they look at how many providers are in the area that are providing the same service, how many members that they have that are needing that service, and then they base it on an average on what is actually being offered. So you may say what your colleague may have a contract with Blue Cross and they're getting paid $107 for a visit, but then a colleague that's in the next town, they may be getting paid $97 for a visit. So it just depends on the day, the location, and also depends on how many members that are being serviced in that area and what they want to offer. Another thing that I also give a disclaimer about is that whenever you receive a contract, you can do contract negotiations, but you only can do that after 1 year. So what we have seen in the past is that if you receive a contract and you don't like the rates, or the rates are too low, and you try to negotiate before you actually get before you actually sign the contract, what they'll do is they'll put your contract at the bottom, make you wait for, you know, sometimes I've seen it wait up to a year to receive another contract, and then they give you the same rates, and they're like, okay, well, you ready to accept our rates now after we put you on a punishment hold, basically. So I always suggest that you go ahead and accept the rates, or decide that, you know, that you want to take that insurance and accept the rates, and then in 1 year you can do contract renegotiations. You can go to the next slide. So we're going to discuss government payers. We have Medicare, Medicaid, and Blue Cross Blue Shield is federal, and then TRICARE. So Medicare is for patients that are 65 and older. Medicaid can be for patients that are 64 and younger. And then Blue Cross Federal is basically federal employees. And then TRICARE is for retired veterans and their family. So, but Medicare, there's a lot of confusion on how to get credentialed with Medicare. Medicare, it has two forms. It has an 855I and an 855B. And so the best way to remember is 855I is for individual and 855B is for business. And so whenever you are getting contracted with Medicare, you have to do the 855I first as an individual, and then you do the 855B as a group. And when I say group, it means your business. So when most people, they think when you say group that there's more than one provider there. No, that's not the case. The group is also is considered your business. So you can be a solo provider, but still have a group, because you have an option to add providers or hire people under your group. So another step, I would say that Medicare will probably be the most challenging insurance to get credentialed with, because there are so many forms that you have to complete. And a lot of this is located in your PICOs, which we'll talk about that later on. But the form 588 is basically to set up your EFT, and it's required by Medicare. What they require is that you have a business bank account that is registered to you as the provider, the business bank account has to match exactly what is on your IRS or EIN form. So if you have a business that is Healthcare LLC, then on your business account, it has to say Healthcare LLC, or else Medicare will reject your application. Then you have the Form 460, which is a participating physician agreement or provider agreement. So basically, this is saying that you accept a Medicare assignment. Medicare, they have standard rates. You can go and you can look up on the Medicare fee schedule and look up a 99213, and that's going to be the rate for whatever state, whatever city, whatever county that you're in. That's going to be the standard rate, and there's no negotiation with that. So basically, you're signing your participating provider agreement is saying that you accept those rates. And then there's the 855R that you have to sign as well. And with Medicare, they require wet signatures. So if you are doing a paper application, which I don't advise, but if you are doing a paper application, you cannot have any photocopies. It has to have a wet signature on there. And then you mail your forms to the Medicare providers. I'm sorry, the Medicare carrier, and then they will process your application. So with the paper application, it does take about 90 days to get processed, and it goes through a process where it goes to the mailroom. The mailroom sorts it out. Then they provide a DCN, which is a document control number, and then it is assigned to a rep. And then the rep has to individually or manually go through through your application and make sure that everything was complete the way that it's supposed to be complete. So basically, have your I's dotted and your T's crossed. Now, the way that I would suggest that you do your application would be through PECOS. And this is online application. And the beauty of this is that if there's anything that you miss on that application, it's highlighted in red. So you will know that your application, if you forgot to put in your MPI on one section, or if you forgot to do your EFT on one section, then it will highlight it for you and let you know that your application will be rejected if you do not complete these processes. So the different names of the Medicare carriers, this is going to be by jurisdiction. And jurisdiction means that it could be a cluster of states. So for Novitas, then that's usually like the southern region, like Texas, Louisiana, Mississippi. Those are usually the southern region in that jurisdiction. And I think they have it's about 7 states that falls under Novitas. And then you have Palmetto and Noridian, the National Government Service, First Coast Services, Wisconsin Physician Services, and CGS Administrators. And this is, I already touched this a little bit earlier today, but they only accept original signatures. And like I said, it has to be a wet signature. And so, and then they want a voided check, or you can have a bank letter from your bank that tells what your account number is and what type of account, routing number, and then it has to have a signature by a teller and have a teller stamp on there. That's the only thing that Medicare will accept. So they will accept either a voided check that has your business name exactly what is listed on your IRS EIN letter, or you can get a bank letter from your bank on a bank letterhead that tells your routing number, account number, and what type of account it is. And then the copy, oh, sorry, if you can go back just one more, thank you. So the copy of the IRS letter, it will be your EIN that you receive when you first register your business. Okay, you can go. Thank you. Okay, so Medicaid. Medicaid, the process is a little different from Medicare. You can still do either a paper application, or you can do an online application. When you do an online application with Medicaid, it does the same thing as Medicare. It will highlight anything that you may have missed, or the information is not registered as correct. Or you can even check the status of your application online as well. So you don't have to wait on hold or calling Medicaid to see what's going on. The only way that I would suggest you giving a call to Medicaid is if it's been in review status for too long, then you know that there's something wrong with your application. Blue Cross Blue Shield, they also have a portal that you will need to register for to do your application. Most of Blue Cross Blue Shield, it's by state. So Blue Cross Blue Shield is a well-known name, and it looks like it's a national plan, but it's not. Each state has their own Blue Cross Blue Shield. And so if you are licensed in multiple states, then you just know that with Blue Cross Blue Shield, you have to get a contract in each state. Now, one thing that I will let you know that if you are licensed, let's just say you're licensed in Texas, and your patient has Blue Cross Blue Shield of Illinois, well, the claim is still going to go through Blue Cross Blue Shield of Texas, and what they have is a system to where it will go. It's called a FSS system, a financial suspension support, and it talks to the home plan, which will be a Blue Cross Blue Shield of Illinois, and they will pull the patient's benefits and then process the claim, but it will all go through Texas. So if you're in that particular case where you are providing the services in your state, the patient lives in your state, then but they have a Blue Cross Blue Shield plan that's from another state, which happens all the time, you always process it through your host state, which would be whatever state you live in. TRICARE. So with TRICARE, it's divided up with two regions, which we'll see on the next slide. There is TRICARE East and TRICARE West. TRICARE, I will say that it's probably the best insurance to get credentialed with. However, it's the most difficult insurance to get credentialed with. With TRICARE, they require you to apply to receive an application. So you have to send a letter of intent to receive an application. To receive an application, it could take up to 90 days to receive an application. Once you get the application and return the application, it can take up to 180 days to process that application. So TRICARE is a really good insurance. However, it's really difficult and it takes a long time to get in network with. And then you can see right here, on the right side, that would be considered TRICARE East, and on the left side is considered TRICARE West. And there's another example that it shows you exactly where the states lie, where the separation is. And I kind of went ahead of myself, but it's still the same thing with the certification. The certification is basically sending your letter of intent and saying that you are wanting to be a TRICARE provider, and then you receive your application, and then once they have credentialed you, then you'll go through the contracting, and then that's when you'll actually receive your contract from TRICARE. And then this is going over basically the same thing that we discussed. The difference between credentialing and contracting. It's just put there multiple times. So, but if there's any questions, if we need to go deeper into that, please let me know and I can explain it a little bit more with your specific questions. So the CAQH, the way that I like to describe a CAQH is basically like your personnel file. With the commercial insurances, they go through your CAQH in order to credential you. So what the CAQH is going to have your employment history, is going to have your resume, it's going to have all your license in there, and it's going to have your liability insurance in there. So whenever you are credentialing with a specific company, you have to give them authorization to access your CAQH, which is located it's located in the CAQH, and there's a tab for that, and I can't remember what the tab is, but it gives you authorization for whatever insurances that you want to be credentialed with, so then they can access it. If you don't give them authorization, this can hold up your application with that insurance company. Now, PECOS, this is on the Medicare side. Whenever we ask for your PECOS login, whenever you're doing credentialing, it's the same thing as your MPPES login. You access it the same way. So whenever you're logging in to correct your NPI, to correct an address or anything like that under your NPI profile, then it will on the right hand side, it will say PECOS, and you can access that under your administration. So, and PECOS is used for Medicare. This is where you're going to find your Medicare application. And also you can use that if you want to be a DME provider, then you can go through there as well to get your Medicare DME provider ID. And we touched a little bit about the MPPES. This is where you register to get your NPI. You have to do 2 NPIs. One will be your individual NPI, which is considered your NPI 1. And then the other one will be your business NPI, which is considered NPI 2. So whenever you are getting ready to be credentialed, you're required to have both. You need to have an NPI 1 and an NPI 2 to register or to credential your business, your practice. So here are the different scenarios. We often get questions when it comes to credentialing, and a provider might say, well, I work for a practice and I think that I'm already credentialed through that practice. So do I need to get credentialed again with my own business? The answer is yes. So the way that I like to explain it is that you can say, well, we know this provider, we'll just say Jane Smith. We know Jane Smith as a provider, but we don't know Healthcare LLC. We haven't met Healthcare LLC. We don't know anything about Healthcare LLC, but we know Jane Smith as a provider. So you have to submit an application and say, okay, well, I'm introducing Healthcare LLC, and Jane Smith is the provider for Healthcare LLC. So what they'll do is they will credential the business, Healthcare LLC, and then they will take the credentials from Jane Smith and attach them to that business. So if you join an organization that, like, let's just say that Healthcare LLC is already in network, there's already a contract, and Jane Smith is already in network, well, then there's a linkage that has to be done. And so that doesn't take long at all. It takes about 2 weeks to do a linkage. So if you already have been credentialed and you go to another practice that has already been credentialed, then all they have to do is link you to that practice. If you are not credentialed, but the practice is credentialed, then you will have to go through the individual credentialing process, and then there will be a linkage done to that specific practice.
Tiana, can I ask a quick question before you move on? Is that also the same thing for a collaborating physician? So let's say I'm a nurse practitioner and I'm credentialing myself in my practice, or I'm already in network with a panel, and then I'm bringing on a physician and they're also already in network. I just would have to do that linkage process because both have already been established with the payer. Is that correct?
That is correct. That is correct. Yes. Yes. Okay. Sometimes we do find where the physician has never been credentialed, they never took insurance before, and the insurance company, even though you have a collaborating physician, some insurance companies require that collaborating physician to be in network. Some insurance companies only require a collaborative agreement, and that's it. So, and we really, the rules change from day to day, so we don't know which insurances require what. But most insurances will require that your collaborating physician is in network before they will actually credential your practice.
Gotcha. Thank you. That's super helpful.
And so this is basically what I was talking about with the new provider. When you're going through that same process, they want to know basically your history. Where have you worked? Where did you go to school? And then they look at your resume as well. If there's any gaps that are on your resume, you have to explain that to the insurance company, just as you would with an employer. Why did you have this gap? So this is all located in your CAQH. And so this is a process that you are required to go through. It seems a little bit intrusive, but they require is their screening for in order to accept you as a provider. Have I seen providers not be accepted before? Absolutely. Have I seen providers be kicked off of the insurance? Absolutely. So it's just like if you were applying to work for an employer, it's the same thing. And that if there is any what do I want to say? Any penalties or anything like that are against you, then you will be kicked off the insurance. I can give an example. I had a provider that was a provider with Blue Cross, and he was a provider with Blue Cross for 15 years. But he had a patient that received that he was operating on the patient, but the anesthesiologist gave them too much medication and the patient passed away. Because he was associated with that at the time with that patient, and he was the one that was doing the surgery, even though he's not the one that gave the patient too much medication, they still penalized him, and then they kicked him off of Blue Cross Blue Shield. So situations like that will come up, and so unfortunately, that's just how they are. And we had to go through an appeal process and explain that they're not the ones that actually committed the offense with the patient. And you have to go through a whole appeal process and everything to get back onto the network. So whenever you sign, whenever you are doing credentialing, and you have a checklist that you go through. So whenever a client signs up with me, I automatically send a checklist. Most of the information that is required for the insurance company is located in your CAQH. If you go to the next slide, here's a list of everything that's needed. This right here is located in your CAQH. The practice name, the group MPI, the tax ID, your full name, address, email. You are required to have a fax. You are required to have a telephone number whenever you're doing credentialing for an insurance. So you might want to look into electronic fax, something that's going to be attached to your email or something of that nature. And another thing that is required is an address. With a lot of providers that are providing teletherapy, or I'm sorry, telemedicine, they want to use their home address. Never use your home address. Go and get a virtual address. And I say this because I did have a client that insisted on using her home address, and then she had a psych patient come to her door. So you always want to get a virtual address so that you won't have patients that are looking for a provider and then they just decide to show up thinking that they're going to an actual clinic. But however, all this information on this checklist is located in your CAQH. One thing that is not on there is the signed W-9. You can get this from the IRS website. Whenever you Google W-9, a lot of different websites come up and they want to make you pay to get a W-9. Don't do that. Always go to the IRS website, and the W-9 is free. So then that's where you can pull your W-9. Oh, I'm sorry. I do see the signed W-9 on here. Okay, go to the next one. So are there any questions that you guys have?
Jasmine and I have a nice list of questions that we think may be relevant to our clients, but I want to go ahead and give everyone that's on here an opportunity to ask first, if you guys have any questions.
Hi, my name is Charlotte. I have a question. Hello, everyone. Hi, Dr. Annie. So my question is, originally, I called Pace, California for credentialing Medi-Cal and Medicaid for IHP. I was told by the call center, you can always talk to the call center, right? That you need an actual address. You cannot use a virtual address. So I went and got an official address, paying the monthly cost, and don't have patients yet, right?
Mm-hmm.
However, other people that I know have a virtual address, and I'm like, how can they get approved with a virtual? When I was told I need a physical address because they may come out and visit to make sure everything is correct, what I put on the application. Now, I just recently got my Noridian Medicare credentialer approval. I also got the CAQH approval for credentialing, and I'm stuck now. I don't know how to. I called several health plans like Humana, Cigna. I put in the application with them, waiting 30, 45 days for approval. Blue Cross and TRICARE said that you can only do out of network. They're not accepting NPs. I need assistance with marketing, getting other credentialing with the other health plans, as well as how do I market to get Medicare and Noridian patients at this time?
Okay, you have several questions. Let me
Yeah.
let me go to the first one. Okay, so with the virtual address, so a lot of people think that with a virtual address that a PO box or with UPS where they actually give you a suite number. That's what when they're saying a virtual address, that's what they're talking about. But whenever you sign up, let's just say that you go through ipostal1.com. It's actually a location. It's an actual physical location. So whenever they do a search of your address, they're going to actually see a physical location for that address, and that is acceptable. The only time that is not accepted is on your with your MPI registry. So under MPPES, they require you to have like you can use your home address, or you can actually use an office address. I say that it's okay to use your home address with MPPES because patients are not looking at MPPES. Like they're most people, unless you actually work in this industry, they don't even know about MPPES. So your address is safe there. But when you are actually credentialing with the insurance company, they don't want you to use a PO box. They don't want you to use a UPS address. They want it to where when they Google it, they're going to actually see a building. And when you are signing up through iPostal One or Regis, you can pick an address that actually has a building. So I hope that answers your first question. And then your second question, which I forgot what it was. What did you ask me?
Well, how to market to get Noridian Medicare patients. I thought I had a patient that had Part B, and then when the patient came to the office for the consultation, he says, I have IEHP, so it's the Medicare Advantage.
Yes.
And in order for me to see this patient, I have to have California Medi-Cal credentialing approval because IEHP is only for California through PAVE.
Yes.
So I don't know how to just get the Part B red, white, and blue Noridian patients only.
I can tell you that when a patient has Medicare only for 30 days, they only have traditional Medicare for 30 days. After 30 days, they have to pick a managed care plan or one will be assigned to them. So
Oh,
whenever you are getting credentialed with Medicare, you always need to get credentialed with the managed care plans. Otherwise, you will not be paid by Medicare. They're going to say that the provider is not enrolled in this program, or provider certification is not, provider is missing certification. So you would have to always be credentialed with that managed care plan.
oh, okay. So I need to call Medicare back and continue that process.
No, so the managed care plans are a separate entity from Medicare. So you go through the Medicare, so you have to get your Medicare ID first, provider ID first, and then you have to do a separate application to each managed care plan. They're not connected.
Got it.
Mhm.
Okay. Like Kaiser, for an example.
Exactly.
Okay. Well, can you do that? Can I pay you to?
Yes, we can take care of that for you.
Thank you. I appreciate that. Well, let's connect afterwards.
Okay.
Thank you.
Tiana is with Medy Solutions Management. So if I know I said that at the very beginning, and we're going to be sending y'all the recording so you have it, but I'll put it in the chat. So she's listed on our website if you can Google her, but she's listed on our website too as one of our credentialing partners. And she's amazing. So highly recommend going with an expert because this whole thing is super confusing. So definitely recommend using the person that knows what they're doing with this.
Thank
Thank
you.
you.
Yes. Thank you so much.
Any other questions right now? Okay.
Hi, I had one. This is Nazia. I don't know if this was discussed. I joined a little bit late, but in order to get credentialed in the private insurances, you need to have your collaborating physician enrolled into each one of them, or if they're working at a hospital and they're already credentialed, but they're signing on with you and your practice, you can have their name, but it's really credentialed under you. I guess I just want to find out, how does the credentialing process work for mid-levels with our collaborating physicians?
It actually depends on the insurance company. So some insurance company only require a collaboration agreement. Other insurance companies require that your collaborating physician is credentialed with them. So you will list your collaborating physician as a provider, even though they may not, they're not seeing any patients or anything like that. They're only, supervising you or whatnot. You have to list them down. So most insurances are requiring that, that your collaborating physician is insured, I'm sorry, that is contracted with them. And so whenever you're doing your credentialing, you would have to do, if the collaborating physician is not contracted with the insurance company, then you would have to do a separate application for you and a separate application for your collaborating physician.
Okay, but let's say they are credentialed through, their own private practice. Do I have to re-credential them under my practice as well?
No, that will be a linkage. So if they're already individually credentialed, then it will be a linkage. So that means that they will say, okay, your practice is called Healthcare LLC. That's the practice name that I'm using for this example. Healthcare LLC. So you credential Healthcare LLC, and then Dr. Joe will be linked to your practice as your collaborating physician.
But they can still bill under their own practice with their own stuff. It's not like by linking it, I'm going to affect anything in their own private practice.
Absolutely. No, it will not. And another example that I like to give is you have Walmart and Target. Walmart and Target, they provide the same thing, they provide the same services and everything, but they are two different entities. So whatever goes on with Walmart, it goes on with Walmart, and whatever goes on with Target, it goes on with Target. They never cross each other, even though they're providing the same services.
Got it. Perfect. Thank you.
Mm-hmm.
Good morning. To kind of piggyback off of this conversation, I had a question. Say for instance, your collaborator is not credentialed. Do they need to get approval first before they'll give approval to the nurse practitioner for credentialing as well? Or is that done simultaneously when you submit both applications?
Yes, so basically what you'll do is you'll submit an application for the collaborating physician, but you'll also, on your group application, you will list the collaborating physician as attached to your group. So you would have to do the individual application first, and then you would have to do the linkage application.
Okay, thanks for that clarification.
Mm-hmm.
Hi, and actually, Courtney and I are in the same area. So, Courtney, let's connect and get busy with it.
I love that.
Yes, thank you, Charlotte. Yes, I am in the California, like SoCal area, if that's what you're referring to.
Yes, I'm so sorry. I'm Jessica's mom, Jessica Jenkins.
Oh, hi, how are you?
So
Sorry, it's such a small world.
Yes.
Yeah, small world. So yes, please, let's connect.
Thank you.
Hi, my name is Hawagoa, and I have a question. Can you hear me?
Yes.
Yeah, so prior to getting credential, or when you're doing the credentialing process, do you need to already have a collaborating physician, or can that be ongoing simultaneously?
Well, it depends on your state.
Yeah, I'm in Georgia.
So you do require a collaborating physician.
Right.
So it's the same thing. With some plans, all they require is the collaborating agreement. And then with some plans, they actually require for your collaborating physician to be linked to your group.
Okay.
This has been so great. Thank you. Any other questions from our attendees that are here right now?
Oh yeah, I have one more question. So she does she has a service that does credentialing. How do we get in touch, like if we wanted her to credential for?
Yeah.
I'm opening my practice of telehealth online, and I was actually looking to have a credentialing service.
Okay.
Absolutely. Yeah.
Well,
Sorry, you go, Tiana.
my website is www.medy, and it's MEDI-solutions with an S, management.com. And from the website, you can schedule a consult with me, and then we can go over everything and then get you started with credentialing. So it's MEDI-solutions management.com.
And I did put the website and the name in the chat box too. So if that's easier for you, click on the website. I put the link in there for everyone.
Okay. Thank you. And then this recording will be provided again to us through the email.
Yes, ma'am. As soon as we wrap up, I'm gonna process the recording, and then I'm going to send an email to everyone that registered. So as long as I have your email, which I believe I do, I will send that out to everybody.
Okay.
And then I had another question. So I know it's predominantly nurse practitioners. I'm actually a physician assistant. So does the credentialing process vary at all for NPs versus PAs? And is that still in scope for your company?
Yeah, it's still in scope, so it doesn't matter. It's the same process.
Okay. And I mean, of course, I'll schedule a call and get into details, but just so like a general idea, is it a group cost, like where you get Blue Cross Blue Shield, United Healthcare and things, or it's like each specific private insurance has like a separate cost for credentialing services, or what work?
Yes, so we base the cost off of completing the application. So with the process that goes on with us is that we complete the application for you, and it's by payer. Each payer has their own payer portal that you have to do the application through. We complete the application, and then we follow up every 2 weeks to find out the status of the application. 2 weeks is a good sweet spot because there's not very much movement from week to week. So they tell us to follow up in 14 days. And so we follow up every 2 weeks, and then we send you a status report to let you know exactly where your application stands.
Okay, got it. And then just like how it doesn't affect a supervising collaborating physician, if I'm opening my own practice and I'm getting credentialed under Blue Cross Blue Shield under a group NPI, and if I choose to start working part-time at another primary care office or something of that sort, and they want me to get credentialed under theirs, there's going to be no crossover, right? The lines will be very black and white.
Yes, there is
Okay.
no crossover. You can work at as many places as you want to.
Is there a limit to how many group NPIs you can be a part of?
No, no, there's not.
Oh, okay.
I like your mentality, Nadia. Okay, great. Anyone else? Any questions?
Oh, I do want to piggyback on that. The only thing is that whenever you are, whenever you're working for different practices, if that person, that the administrator has access to your CAQH, they're going to be able to see where your active locations are. So if you should know that if you give your access to your CAQH, then the administrator is going to know, because you have to select where you're working at is active. And so they're gonna know if you're working at multiple places, or if you're starting your own practice, then and you don't want your administrator to know, then you will need to change your password so that they don't have access to your CAQH.
Got it. But are they allowed to have access to that? Like by me changing my password, is that even a possibility if they're gonna need access to that?
For the credentialing purposes, they will need access to it. But just so that you know that it's going to be listed as active on there. So they may go back and they may say that they may make your location that you're working at as inactive without knowing that it's actually active. So I actually had a situation happen. My mom is a credentialer herself, and so she asked me, well, Tiana, this person it says that it's active on their CAQH, but they work for us. And I was like, well, Mom, they could be working for a different location too. And she's like, oh, I didn't know that. I just deleted the address. And I was like, you can't do that. So you know, it kind of just states where you are. It has your employment history on there. And so if you are currently already working for someone, and then later on you want to start your own practice, then I would suggest you changing your password after you've been credentialed and you don't want anybody to know that you're actually starting your own practice. They kind of get kind of funny whenever they find out that you're starting your own practice.
Got it. Thank you.
Mhm.
All right, great. So we have a few more minutes here. I'm trying to wrap this up at 3 for everyone to respect y'all's time, but I had a couple burning questions that I think might just be good general questions for everyone. So not to take a negative standpoint from here, but what would you say, Tiana, are some of the biggest mistakes or mishaps that you see people making when it comes to approaching credentialing? Is there anything that they can avoid doing to try and save time and really make the process as efficient and successful as possible?
Yes. So one of the things that that I have noticed is sending incomplete packages or files. So whenever you do credentialing, you have a list of items that are needed. And if you don't have that item, like for instance, if you don't have a business bank account, then they are not able to pay you. So they will reject your application, and that just prolongs the process. If you're trying to negotiate rates before actually getting in network, that prolongs the process. That's the biggest thing that I've seen that I have advised against. You have to get in network first and then ask for higher rates after 1 year. But those are the two main things that I've seen in the past, is sending in incomplete files and then trying to play hardball with them when you need them, you know. So those are the two biggest things that I've seen in the past.
That is so good to know. I didn't even know those two things. That's so good to know. Thank you. Super helpful. And then one that I get, especially as time goes on, how can providers maintain their credentials and then avoid lapses in being a network, if that makes sense?
Yes. So the rule is it's either 3 or 5 years. So you are going to have in most commercial plans, you have to re-credential every 3 years. You have to pay attention to the mail that you get. They're going to let you know well in advance that it's time to be re-credentialed. And if you wait to the last minute, the process takes 60 to 90 days. And some insurances, it takes 90 to 120 days. So you have to keep in mind that there is this time frame that you have to allow for them to process your application. So if you wait until the last minute when it's about to expire, well, then you have that lapse in time, because they're still going to be trying to process your application, and they won't retro or backdate it to when it actually expired. So you will have this gap to where you're not credentialed and you have no recourse.
Gotcha. Okay.
So they'll send you a letter like 6 months in advance and let you know that it's time to be re-credentialed.
Gotcha. Okay. That is so good to know. Thank you. Okay. Those are my big questions. Jasmine, did you have any others from our list that you think might be helpful?
Can I just ask one question? Let's say that I came through you, this is how, by the way, and I got credentialed by you. And then when it's time for re-credentialing, can I come back and you know?
Absolutely.
Okay.
Absolutely. Yes.
Okay. Wonderful. All right. So that's all I had on my list. If no one else has questions, we'll go ahead and wrap up. So thank you all so much for joining us. Thank you, Tiana, so much for sharing your expertise and your knowledge. Again, I put her information in the chat, everyone. So if you're looking for additional assistance, definitely recommend going with an expert, especially to avoid some of those pitfalls so you're not delaying progress. So thank you so much, Tiana. We really appreciate your time and for sharing this wealth of knowledge with us today.
No problem. No problem. And if you guys have any questions later on, feel free to reach out to me. My email is in the chat, and I'll be more than happy to schedule time with you. Or if you have questions that you need immediate answers with, then I can respond back to you in the email as well. Okay, I'll look for your email.
Thanks,
Thank you,
Tiana.
Tiana.
Thank you.
And then so everyone else that's still on, as promised, I just wanted to give you some valuable information about our service, about collaborating docs. So if you're doing credentialing and you're in a restricted state, you likely need a collaborating physician as well. So if you're not one of our current clients, you're welcome to stay on, and I'll give you a little bit more information about us. If you are a current client, nice to see you. Thank you for joining us. So, top 10 reasons of why you should use collaborating docs to find your collaborator. We have a very personalized service. As you can see, we are NP led. And so we understand the scope of the mid-level provider, PAs and Ps. So you're really going to be working with a team of people that know exactly what you're doing. And we really understand with your situation and the patients you're going to be seeing and your mission for what you're doing. So we do provide malpractice for the physician. So your collaborating physician will have their own malpractice already. So you don't need to pay to cover them, and you don't need to add them onto your malpractice policy, which is really helpful. We do provide the collaborative agreement between you and your physician, and also state-specific guidance. So we know everything varies state to state. So we provide you legal guidance. Our legal team has developed about state-specific legislature related to collaborating. So we make sure you have all the info you need for that. We also don't have any long-term contracts, so you're not locked into any really long-term contract at all. You can cancel at any time. So our contracts are essentially month to month. We don't have any hidden fees. You're paying a flat rate every month. So there's nothing, no surprises to catch you off guard there. Our support team, so me and Jasmine, we are also nurse practitioners. So if you need any help with anything after you become a client, we are here to assist you as well. We are the industry leader in doing this. So we've helped over 4,000 clients so far. We're actually about to hit 5,000. So that's been really exciting to help so many people across the country get started with their own practices and, really see their success in that. So it's been fun doing that. And then our biggest thing I would say is compliance. So we make sure we do things the right way, the legal way, the best way for, your patients and your practice, so that you have confidence in what we're doing. That's extremely important to us. And the last thing I would say is we have lots of happy clients. So we do have testimonial videos on our website. So if you want to hear from some clients that we have helped and how they've been really happy with what we've done and how we were able to assist them, please go watch those videos on our website. So I'm actually going to put our website in the chat. So it is collaboratingdocs.com. So if you haven't met with us yet, or haven't spoken with one of our nurse practitioners on our onboarding team, please feel free to go to our website, and we can give you a free personalized quote for what a collaborating physician would be for you and your practice in your state. And yeah, that's all. So if anyone has any questions about that, you can let us know. Again, I will be sending out the recording of this webinar to you. So please check that out. That way, you have all the information you need. I felt like Tiana really did a wonderful job of explaining the ins and outs, a lot of details I didn't know as an NP myself. So there's always something to learn. Credentialing such a bear of a process. So again, we really appreciate you all for joining us. Thank you, Jasmine, for helping moderate with me. And again, you guys can email us. So Jasmine and you can find us at support@collaboratingdocs.com if you need anything. And then you'll get my email. So thank you all so much for joining. We really appreciate you. Enjoy your weekend. Happy Friday. And we will see you all next time.
Yes, thank you, everyone. Have a great weekend.
Thank you. Bye.